So this is a very quick video to actually have you catch yourself doing something right when it comes to positioning. And I want to use the example of the last couple of years and really how we think about the COVID vaccines and how we frame the concept of value there, which is most of the job of positioning. So uh, there's typically a couple of reactions. One is the marketing. We'll do it later, and this belief that that's okay, which is wrong, or that people don't really know what positioning is. So if we take the example of the COVID vaccines, I want you to think about the way that you explain them to other people. Whether it's your daughter, your grandfather, your Facebook friends. I want to examine the use of two things, really, the use of framing. How did you frame the vaccines, and how did you derive a value proposition from those? Um, so think about the general framing. Did you just import the idea of a vaccine, or were you thinking specifically about the way that these ones break apart? Were you borrowing from polio, from flu, from travel vaccines, from mumps? It's got to be a very careful consideration because clearly vaccines have a sort of wide spectrum of historical effect and so forth. But you're already assuming that your audience knows something about what a vaccine is, and you're borrowing that framing of what a vaccine is. So there's been good and bad vaccines, and we can see in some of the reaction that people know that there have been bad vaccines historically, and that there's a range of effect of the vaccines that we already know about. Some of it seems obvious, but really, when you do positioning, nothing is obvious. You can't just say it's a vaccine without also examining the baggage that brings with it. So as soon as we're calling it a vaccine or a shot or a jab or calling someone vaccinated, even is a choice of words that's important. Um, we could think about alternatives to that framing. We could think about someone being, treated prophylactically with one of these agents. We could think about preemptive immunization, which is what happens in some disease outbreaks. But when you leave it loose, your audience will fill in their own details, and you are not any longer in control of that. But then think about what you should expect of a vaccine. Think about the way that you would frame your goal for using one in the first place. Is it prevention of infection, prevention of transmission, prevention of illness, prevention of serious illness or death? Um, is it all of those? Is it all of those because of one of the first ones? Is it prevention of death because of the prevention of contraction or infection? Um, which one's the most important? How does your vaccine differentiate from somebody else's in that situation? How did you address the issue of durability? How did you confront the issue of known unknowns that sat next to that? Did you draw from analogs? Did you say it's a bit like this one or it's a bit like this other one, to help your audience try and understand what it was? How did your expected duration of effect? Did you say this is going to work for a week, 2 weeks? Is it going to work for 3 months or for a year? Again, this transparency of communication between you and your audience is really important. When you said that the vaccine was effective, where did you draw your data from? Did you provide evidence for that, or did you just talk about the science in that sense? Did you rely on a chosen expert, or were you really providing full transparency of the data that you were choosing? Were you telling this kind of noble story to try to convince someone to do something different? So then let's think about the value proposition. And, we're all aware that across the course of COVID, we relied on different framings of value to elderly people, vulnerable people, to children, to working age adults. But your choice of value proposition was interdependent with your segmentation. So you're aware that you started to segment that audience. You're aware that you started to frame a value proposition next to those choices. And then think importantly about the way that you provided a framing of class, or were they just a vaccine? Did you get a jab, or did you choose to say, look, the mRNA vaccines are not the same as agents in a different class? Were the Moderna and Pfizer vaccines the same, or were they different? Were they put in a box and said, look, those two are going to behave the same because they're both mRNA vaccines? And how did you choose to communicate that? What was really your call to reason to believe, or to mechanism to explain that? When you talked about the mechanism of disease within COVID, did you talk about the virus and infection, or did you delve into spike proteins, upper, lower respiratory binding? In what way did the consequent illness, long COVID or whatever, derive from that initial cascade? So you're thinking about the kind of story that you told about mechanism of disease, mechanism of effect, and then mechanism of action of your drug in order to gain traction. All of which is really important, because if you just go back through what you just did, you're thinking about your audience, you're thinking about the way that you framed your story, you're thinking about what the vaccine was for, even whether you called it a vaccine to do that, which analogs you borrowed. Um, this is positioning, and this is what the sort of task is to sort of find a way to communicate value to an audience of something that they might not understand, or something that they don't yet have an expectation of. And you can see, therefore, why we argue that it's a early phase approach rather than just a late stage storytelling thing. Because if you decided that your drug was about prevention of death or serious infection or hospitalization or prevention of transmission or infection, well, you've got a different set of studies to do if you choose the proximal ones versus the distal ones. If you choose to take all comers in your study, or all ethnicities even, that would have been a very different choice for some of these things. So, what we saw in the COVID pandemic was this very, odd comparison of headline numbers, which were from non-comparable populations. So someone else's positioning was allowed to win in that situation. None of this is to say that there was a better positioning or a worse positioning within the COVID vaccine space, except that when you yourself did the job of trying to communicate value from the vaccines to other people, you went through a process of positioning. Some of you might have done it better than others. Some of you might have been more persuasive than others. But actually, I want you to think about, these are some of the rules and some of the disciplines of positioning, rather than just crafting a nice story about the kind of ultimate goal of, life running down a beach with your golden retriever. There's a lot more fundamental in terms of choosing where to position your vaccine in the first place, and then telling folks around about the value proposition afterwards. All of which are choices that you have to make. They get made for you, and that's the ultimate goal of positioning. Thank you.